Hello everyone, and a warm welcome to today's webinar, How Online Training Can Support Universities in Tackling Harassment. Today we are delighted to be joined by Dr. Alan Berkowitz, award-winning independent consultant. Alan is also the expert advisor for Epigeum's brand new programme, Tackling Harassment, Promoting Cultural Change in Higher Education. Today, Alan will be giving a pivotal and timely presentation around the topic of harassment, and he will also be exploring how Epigeum's new programme draws on research and evidence-based practices to provide a holistic approach to tackling harassment that can form part of a comprehensive university-wide programme. Next slide, please. So, before we begin the presentation, I will introduce you to our speakers. Firstly, my name is Anna Redding and I'm the Marketing Manager at Epigeum, and I'll also be facilitating today's session. We are also joined by Dr. Alan Berkowitz, who I've just mentioned, and also by Kat Rylance, who is the Commissioning Editor for Epigeum's Support and Wellbeing Programmes. Next slide, please. So in terms of the agenda for today, I will shortly be handing over to Alan, who will be giving his presentation. We will then hear from Kat, who will talk through the programme's creation and show you a bit more of the programme itself. We will then have time for any questions that you have for Alan or Kat at the end of the session. Speaking of questions, you may have noticed that everyone on the webinar today is currently muted. That's just to help us avoid any audio issues. However, please do get involved and ask any questions that you may have at any time. You should all be able to see a control panel for the GoToWebinar software that we are using today. The panel is normally at the top or the right-hand side of your screen. You can expand it or hide it by clicking the white arrow on the orange background. Within that control panel, you should be able to see a questions drop-down, and you'll be able to type your question in, and I can then put these to our speakers today at the end of the webinar. So, without further ado, I'm delighted to now hand over to Dr. Alan Berkowitz for his presentation.
Hello, everybody. I'm in California in the US, so I could say good morning, but for some of you, it's good afternoon or good evening or maybe good night. So the title is very intentional, How Online Training Can Support Universities, because we need to do more than an online training, but an online training can be an important step. And as Anna said, a component of a comprehensive program. And the course is really very well designed in terms of what we know about this issue, what the theory, what the research tells us. So this is a brief presentation to give you some insights into why we did what we did and what's underneath it and what our theory of change is. If we're trying to change behavior, we have to have a theory of change, and we have to have a reasonable belief that what we're doing will produce the results that we want. So my job is to explain that rationale to you. So we can go to the next slide. The agenda is to talk about the goals, what we know. We want to talk about what we call social norms and bystanders. The bystanders are very important because we want people who view harassment, who are aware of harassment, to step in and do something. That's one of our major prevention strategies, and to talk about some recommendations. So the goal is obviously to end harassment, right? And we know that it's everywhere, and we know that it has a very detrimental effect on our students who experience it, as well as on those who observe it, because it's a demoralizing experience to see someone who feels comfortable harassing someone else and not know what to do. So even though we want to end harassment, we need to also know what to expect along the way. What are what we call intermediate outcomes? What are some benchmarks that will let us know we're heading in the direction we want and accomplishing what we want? And those of you that use this course will have access to the evaluation we've designed, which will give you indications of those benchmarks and whether or not you're accomplishing them along the way to reducing harassment itself. I'll go to the next slide and we'll talk about what we know about effective prevention and also what are the elements of a comprehensive program. We use the term science-based prevention because there is a lot of social science that tells us what prevention programs or activities or efforts are likely to produce success. There's also the issue of policies and procedures. We need to have policies in place. They need to be enforced promptly. They need to be perceived as fair. And that's one component. Usually telling people about policies is not an effective way to change their behavior. We all do things that we know we shouldn't do. We know that cigarettes are harmful to our health and we might smoke cigarettes or we might drive over the speed limit. So telling students the policies is necessary, but is not really true prevention. Obviously, if someone experiences harassment, we need to provide services and support for them. And you'll see that the course includes a lot of information about different kinds of support services and systems for victims of different identities or from different groups or backgrounds. That's very necessary, but obviously providing support for victims will not prevent harassment. So we need to talk about prevention. And there's another component which is not true prevention that we call risk reduction, which is if I'm at risk of being harassed, can I do anything to reduce my risk, to make myself less likely to be a target? If I can do that, that will benefit me, but it won't solve the problem. So it's not true prevention, but it's also another component of a comprehensive program. And we know from some programs developed in the United States and Canada for sexual assault that teaching women risk reduction strategies can reduce their personal risk of sexual assault up to 50%. So risk reduction is another component, another thing for you to think about as you develop an array of programs, but true prevention prevents the problem from happening, and that's what we're trying to do in this course. So we can go to the next slide. I've already said that prevention programs must be based on theory and research. I'm not going to go into the research and the theory as much here because of time, but it's important for you to know that everything that we're doing is based on empirical science, evaluations of other programs, and the best knowledge available to us. We need to understand the problem. We need to understand why people harass. If I want to use a problematic word to describe someone, what makes me feel comfortable doing that? And what can you do to make me uncomfortable doing that? So we're going to talk about that today. And we know that there's a lot of barriers. If I say something inappropriate and you want to say something to me, what keeps you from saying something to me? We know that most people want to do something, but they don't. So what are the barriers that we need to reduce? What are the infrastructures that we need? Obviously, for an online course, we have a technological infrastructure to deliver the product. But then when you think of all your prevention programs, you need to know if you have the resources and the structures in place to deliver them. And then finally, prevention is a process and efforts must be adapted and modified over time because as we interact with the issue, we produce changes and we need to modify our efforts. And those of you that use the Epigeum consent course know already that we've already revised that after only a few years to adapt it to the new realities. So let's talk about what are the elements of a successful program in the next slide. A successful program is comprehensive. That means it reaches all the relevant parties. That would include faculty and staff. That would include administrators. Most of you probably know that we have a version of this course for faculty in class. It's intensive, which means it engages the person in an interactive way. Obviously, an online course is only intensive for a brief period of time, but then you add other activities to supplement that course that continue the engagement of the student in an interactive, intensive way. It's relevant, which means it's designed to appeal to the audience. And we've had a lot of help from some of you, from student affairs professionals and from other experts to tailor the course to the audience. And Epigeum has a New Zealand version. We have different versions of the course for different countries because we're dealing with different relevance issues. It has positive messages. This is very important. We tend to think when we want to change someone's behavior, we scare them. If we don't want you to smoke cigarettes, we show you a picture of your lungs all black from smoking. And we know from a lot of research that negative scare messages do not work. Very often they can produce a backlash. And so we focus on the positive. What can I do that would make a difference? What could I do that I would feel good about doing it? What are the positive elements of human behavior that we're not aware of that would inhibit the problem. So once again, if I want to tell an inappropriate joke and I know that you don't like that joke, I'm not going to say it. So that's a positive information about you that will inhibit me from engaging in harassment. And we know that it has to be based on data. We have to always be collecting data, and we have to adapt our efforts to what we know about the problem. And as we said, even though the evaluation is brief, we have an evaluation matrix for this course that will give us some of the data we need. So if you want to summarize this, we like to say prevention programs are PIE, P-I-E. They're positive, they're inclusive, and they're empowering. They're inclusive, which means all the people who are taking the course feel part of the course. We are speaking to all elements of the audience, and it's empowering because I learned something from the course that gives me the opportunity to do something that I wouldn't have done. Next slide. So if we think of any problem like harassment, sexual assault, we have at-risk individuals who are at risk of being harassed, and we need to help them without making them feel that it was their fault for their harassment. This is very critical. No one is at fault for being harassed, even if they put themselves in a risky situation. So we don't want people blaming themselves. If we had time, we can't do this in an online course. We know that teaching people self-defense skills is very effective in reducing their risk of harassment and sexual assault because they have a way of responding. So then if someone is a perpetrator, how do we inhibit the perpetrator? We need to understand the mindset of the perpetrator. We need to create an environment that inhibits the perpetrator. And finally, this is a major part of the course. How do we encourage bystanders to intervene? Which means we need to know what keeps you from saying something if I make an inappropriate remark. What skills would be appropriate if I'm your supervisor where there's a power differential, or I'm from a different ethnic group, or you're a more quiet person, or someone else is a more directive person. So we need to teach different types of skills, and we need to strengthen the norms that inhibit violence. I already mentioned one. If I know that most of you don't like me to use a certain word, that's a norm. That's a shared attitude. And if I know that you feel that way, I'm less likely to do something inappropriate. Next slide. So you can see we want to cover all these three bases of providing information that's relevant to potential victims at risk, providing information that's relevant to potential perpetrators, and providing information that's relevant to bystanders. And the course is part of a mutually reinforcing synergistic set of programs to foster a comprehensive environment. So we're going to keep emphasizing that even though we're very proud of this course, even though we think that as courses go, this is a really good course, this is a really good component, it's not the whole solution. And so we know that one thing, whatever you do, is not enough. And therefore, as we keep saying, an online course is part of a comprehensive solution, but not the solution. Next slide. So let's talk on the next slide about some of the elements of the course. The social norms approach, which has actually been used a lot in the United Kingdom and Australia and Canada, is a way of telling people about what other people think. So for instance, if I think that most of my friends drink alcohol, I might be more prone to drinking alcohol. If I know that my friends don't drink as much as I think, I might lower my expectation or what I feel they expect me. It's the same for harassment. If I know that most people don't like a certain joke, or if I know that most people will respect me if I step in, then I'm more likely to step in. So you'll see that a big component of the course, a theme throughout, is telling students that most students agree with them that these are unacceptable behaviors. And we even have a mechanism in the course for your university to tell them what % of students answered a certain question a certain way, to let them know that there's what we call a positive silent majority. There's often a silent majority that wants to do the right thing, that thinks it's a minority. So we want to correct that, and we want to give people the skills, as I said. There's a lot of programs, some delivered in the US, that use one or the other, but we know from research that both are effective, both are more effective together than either alone. So these are two of the main elements of the course. Next slide. So we want to talk a little bit about, again, the social norm. It's what I feel is acceptable If I feel it's acceptable for me to harass someone, why do I think that's okay? It's an unspoken rule. When we go to a restaurant or we go to an event, we dress a certain way according to the norm. If we go into a religious church or mosque or synagogue, we know that in some places you wear a hat, in some places you sit, in some places you don't sit. So those are norms, they're unspoken rules. And most of the time they're visible. In the examples I gave, the norm is visible and it's not a problem for us to understand and accept the norm. But what if the norm is invisible? What if I don't know that you don't like it when I use a certain word? What if I think that most of you are more sexually active than you really are? What if I think that most of you drink more alcohol than you really are? Then we have what we call a misperceived norm, a norm that is perceived incorrectly. And people's behavior is based on their perceptions of norms. And when norms are perceived incorrectly, people behave according to misinformation. So we want to give people correct information. I'll keep using this example. The perpetrator of harassment needs to know that their friends don't like it. Even if some of their friends think it's funny, most of their friends don't like what they're doing, and they don't know that. So we want to tell people the truth, and we're collecting the truth about each other in this course, and we're telling the students what they told us. Next slide. By the way, that's also a way of making it relevant, because if the course is telling you what other students at your university, how they answered a question, it's tailoring it to them. It's not saying most students in the UK. Maybe I'm in New Zealand. I don't feel that's relevant to me. Even if I say most students in the UK, well, my university is a little different. I don't think we're like other people. So we give tailored feedback in the form of misperception correction. Why? Because we know that individuals overestimate the negative. Pick any negative behavior, ask people, how often do you think this happens? They will overestimate it. Pick a positive behavior, people underestimate it. It's an interesting commentary on human beings that we see more of the negative and we see less of the positive. If someone is perpetrating harassment, they overestimate the most. So they think other people like it more than they really do. I'll give one example. There was a social norm study in Australia about immigration, and they found that most Australians had positive, receptive, supportive attitudes towards immigrants, but most people thought they were in the minority, and the people who perpetrated misbehavior against immigrants thought that they were in the majority. So the perpetrators overestimate other people's agreement with what they're doing, and they use that as an excuse. Well, most people think it's okay. Most people agree. Most people drink a lot. So why are you telling me about my drinking? So if misperceptions predict behavior, misperception correction can change behavior, and that's what we're doing in the course. Most of what I'm saying is based on sexual harassment and sexual assault research, which is more advanced than harassment and hate crime research, but we also know this is true for alcohol. And as I said, the social norms approach to alcohol use has been used a lot in the UK, Canada, Australia, and New Zealand, and other countries. Next slide. So I'll just give you some terminology. If I'm in the majority, but I think I'm in the minority, then that's called pluralistic ignorance. So you don't like what I said, but you think most people didn't mind. That's pluralistic ignorance. If I'm in the minority, but I think I'm in the majority, that's false consensus. I falsely think that most people agree with me. And we know that perpetrators of all kinds of misbehavior and high-risk behavior falsely think that other people agree with them when other people don't, and other people don't say anything because they're in the minority. They think they're in the minority when they're in the majority. So how do we flip this? How do we get the majority to understand that it's a majority and the minority to understand it's a minority? That's one of the things we're trying to do in the course. Next slide. So I've already hinted that when you underestimate other people's concern, you're less likely to intervene. When you're perpetrating, you're more likely to perpetrate when you think that people agree with you. And victims are more likely to blame themselves when they don't know that other people are intolerant of the behavior that caused their victimization. So we're trying to surface the truth and tell people the health of the community. And when we tell people the health of the community, we believe that we will have less harassment because that will inhibit the perpetrators and it will empower the bystanders. Next slide. So if I'm a bystander, I'm standing by, I'm not doing anything. So what do we want to have happen to get people to do something? We want people to notice the event. Maybe I don't know that a certain word is derogatory for a certain group. So we learn that you shouldn't use this word about this group, and now I hear people saying it a lot. I need to interpret it as a problem. I can't say, well, it's no big deal. That person didn't mean it. It's only a word. I need to notice the event and interpret it as a problem, and I need to feel responsible for dealing with it. What can I do to prevent this? What can I do to take on a role as a prevention agent, as an active bystander? And how do I do that? As I said, in different situations, we might have different ways of responding. So we're trying in this course to take our participants through these 4 stages, but then you're trying to take them through these 4 stages and all of your other efforts, because the course is not going to do it by itself. The course is kind of like an appetizer, if you think of it. It's like getting us started. It's getting our juices flowing. It's introducing students to these issues. It's getting them to think about it. But then we need to do more than the course, even if we like the course and we're proud of the course. Next slide. So let's talk about if people are uncomfortable, why don't they do anything? Like, why don't people say something when they hear something inappropriate or see something inappropriate? Number one, we look around and no one seems to be doing anything. So we think, well, maybe it's not so bad because no one did anything. That's called social influence. Maybe I don't want to embarrass myself or you or the observer. So I'm afraid that if I say something to you, I'll embarrass you, I'll hurt our friendship. Other people will think I'm being rude. So the question is, how do I say something that doesn't cause embarrassment? We assume that someone else will do something. That's called diffusion of responsibility. If you take emergency response training, they teach you, don't say, would someone call the police? Say, who has a cell phone? And when someone raises their hand, we say, would you call the police? Because then there's no diffusion of responsibility. If we believe that others aren't upset, we're less likely to do something. And if we have a fear of retaliation, we're less likely to do something. So from one point of view, we could say there's a lot of good reasons for not doing something, but those reasons might be based on a misunderstanding. The reasons that I don't do something might not be correct. Maybe you do think it's a problem. Maybe I can do something without embarrassing you. Maybe other people, are willing to do something, and maybe I could do something without a negative reaction. So we want to correct these beliefs in order to get people to intervene. And that's the purpose of bystander intervention training, which is also being used in the UK and the other countries that are using this course. There are skill-based workshops with scenarios and role plays to teach people how to intervene, and something like that would be a great follow-up for this course. Next slide. So what am I going to do? I can talk to the person or I can talk to the other bystanders. If I don't think that other people are concerned, I could say, what did you think of that comment Alan Berkowitz made about whatever, about Brits, about the UK, about something? And then you talk to other people and you find out that they didn't like the remark either. You can even talk to another bystander after the event. You can say to someone, I was at lunch with someone and they made this remark and I didn't know what to think of it. What would you think of that remark? So we always want to engage the other bystanders by talking about what we're seeing and hearing and involving them in the process. We could do that now or later. So if someone says something inappropriate, you can talk to the other bystanders right away or later, and you can talk to the person now or later, depending on the seriousness of the event. If someone is in danger of physical harm, you want to do something to stop that from happening right away. But if someone verbally harasses someone, you may or may not want to say something in the moment, depending on the situation, the people involved, and the seriousness of the behavior. So you can talk to the person or the other bystanders. You can do something now or later. And then what do? You can confront the person. You can say, that's not okay. Please don't use that word around me. You could tell them that it upsets you. That's what we think of as bystander intervention. But you could do something different that we call shift the focus. You could create a distraction. If someone is harassing a group, if a group of people are harassing a person on the quad in the middle of our campus, I can go up to them and pretend that I'm lost and say, excuse me, I'm sorry to bother you, but where is such and such a hall? And while I'm distracting them, the person leaves. This is actually a true story that happened on a campus in the US, where the bystander pretended he was lost and distracted. You can create all kinds of distractions. You can just make a noise. You can ask about it something different. You could say, does anyone going to the rugby game? I'd like some people to go with me. And anytime you create a distraction, you break up the situation and you create an outlet for people to act differently. If someone makes a negative remark, in the US, people will say that immigrants are costing the government so much money. And I could say, well, actually, do you know how much taxes immigrants pay? Immigrants pay much more in taxes to the US government than they receive in services. So instead of confronting the person, I tell them something positive about the group that contradicts the negative comment they made. That's also called shift the focus. The third skill is to have a conversation to say, Alan, I'd really like to understand why you feel that way. Could you tell me how you came to that conclusion? And you have a conversation with the person. And then after you've listened to me, I'm willing to listen to you. And you say, well, that's interesting because my experience is really different. I don't feel that way. Now, obviously, we're not going to teach people these skills in an online course in depth, but we're going to tell people that they have the opportunity to use these skills, that they can create a distraction, that they can say something to the person. And then we're hoping that later on you'll do more to help them practice the skills. Next slide. So just moving towards a summary, what do we want to do? We want to identify and support healthy norms. And you will see that the course is designed to do that. We want to focus on bystander intervention because the bystanders of the event can really make a difference. We want to avoid fear-based approaches and scare tactics. There is one instance when fear works, which is if I know that if I drive over the speed limit, I'm likely to get a ticket, at least in the US, on the highway. So I don't drive over the speed limit because my fear of getting a traffic ticket prevents me from driving too fast because I know something bad will happen. But most of the fear-based approaches that we use don't work because people aren't afraid of damaging their lungs from smoking cigarettes or drinking alcohol for their liver because they're more concerned about the immediate situation. So most of the time our fear tactics don't work. We want to create environments that inhibit perpetrators, that even if I think these things, I know that I can't say it or do it in front of you. And really important, we want to reduce victim blaming and provide victim support. We never say, well, why did you go there at 3 a.m. in the morning when it's like a dangerous part of London? Even if it is a dangerous part of London, and even if they could have avoided the event by not going there, the blame is on the perpetrator for doing something that is unacceptable. Next slide. Final remarks. Online courses have been found effective in fostering bystander intervention, correcting misperceptions, and in some cases, changing behavior. So we know we're on the right track, that the research supports what we're doing. As we keep saying, online training can be a valuable piece of a comprehensive program. And a true evaluation should focus on behavior rather than knowledge. In this case, we're making an exception, which is we're asking the students questions to determine if they understood the material in the course, because you want to know that your students are taking this seriously. You want to know that your students are paying attention. So we give them a definition. We say, what's the correct definition for this? So that's useful to the university to confirm that your students are taking the course and paying attention. but it's not useful to us in knowing whether we change behavior. Behavior change is usually not associated with knowledge change. So you'll see the evaluation includes a lot of other questions on misbehaviors, misperception questions, on did you intervene in the last month? Then a month later, we hope that that number will go up. Next slide. Finally, what are the benefits of online training? It's obviously easily scalable. It builds foundational knowledge and skills to build on in other programmatic efforts. It allows users to explore sensitive issues in a safe, anonymous space. And it makes a statement from the institution to the student about institutional values and priorities. We know in the US that we have a backlash among some students to our online courses. Maybe we have an online course that shows a same-sex couple in a course about consent, and some people think that's wrong or they get upset about that, and the course produces a negative reaction. That's not necessarily bad, because you're saying, this institution, if you come here, this is what we believe, this is what we feel, and you're going to be a member of this community, you need to know our values. So you will get some pushback. We had some pushback in Australia about the consent course because people were misunderstanding what we were doing. But the pushback is part of the process of prevention. And when you have pushback, you need to welcome it. Well, now's a good opportunity for us to clarify what we're doing and why, because people aren't understanding it. And we once again affirm our institutional values and priorities, and we act on them, and we ask our students to act on them. So just to end by saying thank you all very much. We know that you're here now or viewing this in the next slide, viewing this program, this presentation at a future date. So we want to appreciate your interest and your concern, helping us, our students, and our other members of our community expressing their values in action. Finally, as I said, what we're doing is based on a lot of research. So the next slide just shows some of my own research. I am on my website. I write articles with 4 pages of a bibliography, so references. So if you feel you want to go into any of this deeper, you can go to my website, and then that will put you in touch with the other research on this issue, including in the UK, New Zealand, Canada, Australia, and you're welcome to dig deeper. And the last slide is my contact information. You could always feel free to contact me either through Epigeum or directly. I love hearing from people who listen to these webinars, and I know that I could always do a better job, so your feedback can help me do that. So I'll say thank you all very much, and now I'll turn it over to the hosts, and I believe we have a few minutes for some questions.
Thank you so much, Alan. It was such an insightful and interesting presentation. So thank you again so much for joining us today. It's been so great to have you on this webinar. Before we come to the questions, which we will at the end of the webinar, so please don't forget to put any questions that you have in the chat in the questions panel. I'm going to hand over to Kat, who, as I mentioned, is the commissioning editor for Epigeum support and wellbeing programs. Kat's going to talk a bit more about the creation of the program, tackling harassment, and also the collaborative efforts behind putting the program together. So I will hand over to Kat.
Thanks very much, Anna. And just to echo Anna's thanks to Alan for such an interesting and thought-provoking presentation. Well, this past year has thrown the pervasive issues of harassment and hate into sharp relief. As we're all aware, these issues are nothing new, but during the pandemic, we have seen a spike in incidents of hate and harassment, both across society and within our university communities. And as was highlighted by Universities UK, universities are in a unique position to equip students and staff with the knowledge, skills and confidence to promote positive cultural change, both within the university community and as part of wider society. Across the sector, significant progress has been made in preventing and responding to sexual harassment in particular, but there is a need to increase our efforts to address broader issues of harassment and hate. So today, I'm really delighted to introduce you to our brand new programme, Tackling Harassment, which published last month. It's a comprehensive and interactive online programme which is designed to support universities in tackling harassment and hate through raising awareness and promoting positive cultural change. It recognises the need to provide primary prevention education to minimise harassment and hate, combined with secondary prevention education to ensure that the university community is equipped with the knowledge, skills and confidence both to intervene when it is safe to do so, but also to provide an effective first response when disclosures are made. As Alan highlighted, the programme can be used flexibly to support and complement existing initiatives at institutions, and it aims to provide a consistent, scalable foundation on which you can further build. The programme consists of 2 complementary modules, and when we were doing the research for this programme, the feedback we were getting was that we should keep these as brief as possible because everyone at universities is obviously very time pressed. So each of these modules is less than an hour in length. The modules have been designed to enable institutions to provide a whole university approach to tackling harassment, with being an active bystander suitable for anyone who witnesses a problematic situation and may need to intervene. Most often this may be a student. Responding to disclosures is suitable for anyone likely to receive a disclosure of harassment or hate, and most often this may be a staff member or perhaps a student leader. And as you can see from the programme overview, we've aimed to be comprehensive in the content coverage, with early screens building knowledge around the fundamental concepts and issues, and then later screens focusing on developing those skills. Next slide, please. We've had the benefit of collaborating with a lot of amazing people across the sector to develop this programme. Alan, who you've already heard from this afternoon or morning or evening, depending on where you are in the world, he's our wonderful expert advisor and has been highlighted, an award-winning independent consultant specialising in culture change, gender issues, ending men's violence and fostering social justice. Alan has played a really key role in helping to shape the overarching vision for this programme and providing expertise on approach, content coverage and level. And Angie Wright, who is Education Development Lead at charity Stop Hate, has written the programme, and she brings a wealth of experience from delivering in-person training across universities. Next slide, please. One of our expert panellists commented that this programme is the product of many different voices coming together from diverse backgrounds, disciplines and sectors, with the shared goal of increasing understanding of hate and harassment and equipping people with the skills, knowledge and confidence to stand against it. And I really couldn't put it better myself. The expert panel benefits from a diverse range of expertise, from academics to student services staff, senior leaders, and importantly, students. All of the expert panelists have provided detailed feedback and guidance from the overarching vision, aims, and the shape of the programme, and they've also been involved in reviewing and advising on the developing materials at every stage of the process. It's been a really great source of personal pleasure for me to work with this group and their expertise. Something that was really important to us when developing this programme was that it represented genuine co-creation with students. You can see that we've had the benefit of students joining our expert panel, and they've commented and fed back on the programme throughout development. But we've also had many students sharing their lived experiences with us in the form of audio interviews and animations that you'll find throughout the programme. We're really grateful to all those students who have taken the time to share their experiences with us. It's really enhanced the programme. Next slide, please. Good learning design is something that we take really seriously at Epigeum, and we put a lot of work into developing and planning the learning design for each of our programmes to ensure that the modules offer the most engaging and best possible learning experience, mixing a variety of activity types and learning tools to increase engagement. We developed a bespoke learning design framework for each module in the Tackling Harassment programme, and for being an active bystander, we focused on the following key aspects: how to most effectively support knowledge acquisition for such a broad audience, how to effectively promote behavioural change within the context of an online programme, how do we ensure sufficient opportunities for the learner to reflect on their own context and experience, and finally, how do we ensure that the learner is equipped with the skills and confidence to intervene when it is safe for them to do so. So drawing on the research and the evidence-based practices that Alan highlighted earlier, we therefore developed the pedagogical framework that you see on screen for this programme. It's not designed to be a rigid structure for the module, but rather it is intended to help guide and define the pedagogical aims of the module and provide a guide for the most effective way to present content according to its aims. Input content is content designed to provide key information and key concepts. within the module, and this can be done very effectively through a range of media, including, for example, animations, audio, and infographics. Scenario-based learning is incorporated throughout the module, and learners will be presented with multiple adaptive scenarios. They're required to work through each, using knowledge gained through the input activities to identify problematic behaviour and appropriate strategies for stepping in if safe to do so. The learner's pathway through the scenario changes depending on their responses. By including adaptive scenarios in an online environment, we allow the learner to test ideas and responses in that neutral or safe space that Alan highlighted, without fear of judgment. And we make sure that we scaffold and reinforce the learning, so frequent feedback is provided at key stages as the scenario develops, and users are able to go back and change their answer options to see how their choice affects the situation. A really key element of the learning design for this module, which Alan talked about extensively, is the social norm theory. There's a growing body of evidence to suggest that social norms intervention can be effective in behavioural change and prevention education. And in this module, we employ peer perspectives to promote those healthy norms and correct common misconceptions. So, for example, a common misconception may be that, as Alan highlighted, no one else is concerned about this behaviour, so I shouldn't intervene. And by correcting that misconception, we can reduce barriers to intervention. And finally, the research shows that education provision in this space to be effective needs to be tailored. So as such, we've developed activities designed to promote reflection and encourage learners to apply what they've learned to their own personal context. There are also opportunities throughout the programme to further tailor the learning experience by customising the programme to meet your own institutional needs. Next slide, please. The learning design for responding to disclosures is on screen, and I just wanted to highlight some of the differences in approach to the other module. For the modelling and practice element, we provide learners with multiple case studies which they work through, modelling and practicing those key skills for effective first responders. In the early stages of the module, this element of the learning design is relatively heavily scaffolded to build confidence. So learners are asked to select from drop-down boxes rather than provide independent responses. And again, we provide frequent and detailed feedback. In responding to disclosures, we really wanted to foreground the impact of harassment and hate on those affected and the wider communities, to engage the learner with the importance of that first response. To do this, we've incorporated the victim voice throughout the module. And the final element of the learning design for this module is scenario and self-efficacy. The module concludes with one complex and less scaffolded scenario. Questions around this scenario involve free text responses, and learners are asked to reflect on their confidence levels. This element builds on the previous modelling and practice component, consolidating confidence in the learner's ability to respond appropriately. Next slide, please. So I now want to briefly run you through some of the main features of the programme, but I would also encourage you to request trial access so that you can have a look through in more detail and test out some of these activities and features for yourself. There'll be information on how to do that at the end of the session. This is the introductory screen for being an active bystander and a few features to highlight. The programme obviously covers sensitive content, so this is something we're very aware of. So we have included a detailed content warning at the top of the screen, and there are quick exit buttons included throughout the course. The quick exit button covers the content and signposts learners to sources of support. There are also instructions on how to navigate back to that screen or navigate to the next page, depending on the learner preference. Most screens in our programmes include clickable buttons on the right called pods. And these contain information that supplement the core learning and contain additional information, links and resources. On this screen, you can see an example of a support pod, and these are included throughout the programme, providing information and advice on further sources of support and tips on self-care. These pods can be customised so that you can add in your university-specific resources. On this screen, you also see an animation, and animations are used frequently in this programme to present key concepts and information in an engaging way. Next slide, please. Poll activities, as presented on this screen, are a really good activity for incorporating social norm theory. So you can see on the screen that the learner is presented with a scenario and they're asked how they would feel when witnessing that behaviour. They are then presented with those options to respond, and once they've made their selection, they can see the range of anonymous responses from their peers, along with some feedback. And by doing this, you can see what your peers have said, drawing on that research and evidence base that Alan mentioned, which demonstrates that knowing that you are not alone in your discomfort about a scenario can encourage the healthy majority to intervene, while knowing that others don't approve of those actions or behaviour would inhibit the unhealthy minority from speaking and acting inappropriately. The scenarios also personalise the learning by putting the learner directly in the scenario. And you can see at the bottom there that we include a glossary pod on every screen. This links to a download document listing all the unfamiliar terms in the programme, along with their definitions. The document can be downloaded and referred back to as the learner progresses through the programme. Next slide, please. Opportunities for reflection and personalisation feature really strongly throughout the module, and often in combination with an input activity. This allows users the opportunity to cover the core concepts and then immediately apply them to their own context. And here you can see that we follow a bespoke infographic on tips for staying safe online with a drag and drop activity, which encourages the learner to think about which strategies they already have in place and which they may want to introduce. This then generates a bespoke action plan, which again can be downloaded and referred back to. Next slide, please. As mentioned, real student experiences are really central to this programme, and you'll see them included throughout the course. They allow us to provide the peer perspective and highlight the impact of hate and harassment, both on the individual and the wider community. Next slide, please. In addition to support pods at the relevant places throughout the programme, we further supplement this with a sources of support screen at the end of the module. This provides further resources and signposting relevant to the different aspects of identity that we cover in the programme, as well as specific tips on supporting a friend and self-care. Next slide, please. The Responding to Disclosures module has a similar look and feel to being an active bystander, but you can see from the screenshot included, it's got a different colour theme. Again, in this module, we use a range of input activities, such as this related concepts diagram, and this covers the key skills involved in active listening, which equips the learner with the knowledge and skills they need to respond effectively to a disclosure. Next slide, please. Action maze activities support the modelling and practice element of the learning design that I spoke about earlier. Here, the learner is presented with multiple short scenarios of disclosures, and they work through their response, which determines how the scenario plays out. At this stage of the module, the learning is heavily scaffolded, and the learner is presented with the options for their next steps, rather than being required to think of them independently. And again, at this stage, feedback is frequent and detailed. As the module progresses, we remove that scaffolding and we present the learner with more detailed scenario, which requires free text responses, rather than selecting one of multiple options. And the purposes of this is to develop that self-efficacy and the confidence and the ability to respond. Next slide, please. The Responding to Disclosures module closes with a skills evaluation and a summary of learning. Here, the learner can reflect and categorise their levels of confidence with regard to specific knowledge and skills learned from the programme. A nice feature is that once an item has been categorised, we provide some further feedback and tips specific to that item. And again, once the activity is complete, the learner can save a summary for reference. Next slide, please. And finally, as Alan highlighted, we're very aware that digital education in this space works best when it is one part of a much more comprehensive approach. And so to support that, we've developed an accompanying guide, which contains plans for blended learning sessions. And these expand and develop on the key themes and ideas explored in the programme. The suggested activities can be delivered either in person, once we're hopefully all able to get back on campus, but in the meantime, they can also be delivered via online platforms such as Teams or Zoom.